Good afternoon and welcome to the SAFE Project, SAFE Community Playbook. We'll get started in just a moment. All right, well, hello. My name is Josie Beets. I am the Senior Director of National Coordination for SAFE Project. Welcome to our webinar series about the SAFE Community Playbook. Today, we're going to be talking about using the Community Pulse Survey, a tool that's within the playbook. And I'm excited to tell you all about how that tool can help you be productive. First, before we go on, I want to just go over what we're going to be covering today. So this is our very brief agenda. First is I wanted to let you know there are a couple of tools within the Zoom webinar tool that will allow you to ask questions. There's a Q&A window that you can open and type in a question. I will try my best to answer questions as we go along, but we also have a separate Q&A section at the end of our webinar, as you can see on the agenda. In just a moment here, I'm going to introduce you a little bit to SAFE Project for those of you who aren't aware. For those of you who are, don't worry, it won't be too long. But I just want to make sure everybody's on the same page. And then we're going to dive in to the Community Pulse Survey, a tool that's part of our evaluation piece of the SAFE Community Playbook. And we're going to talk a little bit about why that's a useful tool, why you would want to survey the community, what's the type of feedback you can expect to get. Then I'm going to tell you about some tools that we've created at SAFE to help you roll that SAFE Pulse Survey out to your community so you're not working from a blank slate. You've actually got some tools to help you communicate and market that survey to the folks in your community. And then finally, we'll have, of course, our Q&A and our invitation to our next webinar where, sneak peek, we will actually be talking about the community resource exercise, which is the second part of that evaluation piece from the SAFE Community Playbook. First, I want to tell you a little bit about SAFE. For those of you that don't know, SAFE stands for Stop the Addiction Fatality Epidemic, and was founded by the former Vice Chairman of the Joint Chiefs of Staff, Admiral Sandy Winnefeld, and his wife, Mary. Admiral Winnefeld and Mary lost their youngest son, Jonathan, to a heroin and fentanyl overdose in 2017, a loss suffered by so many American parents. And they decided that they wanted to stand up this organization sort of in Jonathan's commemoration. The goal that we wake up with every day and the directive that they give us every day is how can we keep another family from going through this? How do we save a life today? And you can learn more about their story at our website, safeproject.us, or there's a little video at the short link that you can see at the bottom of your screen, bit.ly/safe story. And we can circulate those after the webinar as well. At SAFE, our philosophy is centered around our 6 lines of operation. If we are going to reverse the opioid and addiction epidemic, we have to treat it like the national emergency it really is. And we have to act along these 6 fundamentally interrelated lines of action in our communities, on our campuses, and with our veterans. These 6 lines of operation are designed to help prevent additional people from falling victim to addiction and to help those in recovery and those who love them. Our 6 lines of operation, they are our hypothesis. We know we need to work on all 6 individually and together in order to make a successful effort to make positive progress. Those lines of operation are law enforcement and criminal justice, prescriptions and medical response, family support and outreach, full spectrum prevention, treatment and recovery, and public awareness. You know, we can't just work in one. We can't just work on prevention and ignore treatment and recovery. We can't just focus on law enforcement and ignore public awareness. You know, if we give law enforcement the tools to divert people out of the criminal justice system and into treatment to prevent them from being justice involved and to understand that addiction is a disease, that's not going to be helpful if you don't have treatment facilities nearby that can take those patients and actually help them get into sustainable recovery. So that's just one example about why we look at these as a comprehensive effort. And everything we do is focused on how we can bring these 6 lines of operation together to create that comprehensive collaborative effort. And so right now we do that through 3 signature programs. We have SAFE Veterans, where we are engaging with the service member, veteran, and military family community to educate them on the dangers of substance use disorder and prescription drug misuse. We are also hoping that from that program we can enlist veterans who are natural leaders into being a part of our solution in communities to make positive change happen. So really, you know, using those leadership skills that they learned in the military to help us with some problems in the civilian world. We also have SAFE Campuses. SAFE Campuses is our effort to make a recovery-friendly community on every 2- and 4-year college campus in the United States. And we just closed out the first year of our Collegiate Leadership Academy. We are also in the midst of an outreach campaign where before the end of the summer, we will reach 1,000 2- and 4-year colleges and encourage them to make sure that they're supporting their students on campus who are in recovery. What we are here today for, however, is that big circle in the middle is SAFE Communities. SAFE Communities is my project. It is a focus of SAFE project overall. And the goal of SAFE Communities is to make sure every community has the tools they need to make positive, sustainable progress on the addiction epidemic. Now, why SAFE Communities? It's really because we know that this is not a crisis, whether it's opioids or addiction more generally. It's not a crisis that will be solved at the national level. It will be solved at the local level, neighbor to neighbor, community to community. And since that's where those solutions need to happen, that's where we at SAFE Project want to build the most capacity that we can, using our 6 lines of operation, using the expertise that we've developed along those 6 lines and comprehensively to create a coordinated response. If you were in our last webinar, you saw sort of the 10,000-foot view of the SAFE Community Playbook. Today, we're really going to drill down into that second piece, right? So the first step is to build a coalition of stakeholders, build that deep bench of folks in your local community who can help you make that positive change and positive progress, right? And it's important to have not just folks who are in the behavioral health field or in city government, city, state, and local government, but your local business leaders and the schools and your churches and your local social clubs all need to be at the table because all are affected by addiction, whether or not they realize it on the surface, and all need to be a part of the solution. And then, of course, our step 2 is evaluating your community, figuring out what needs to be done. And that's what we're going to really dive deeper in today with the pulse survey. So the pulse survey is part of that evaluation piece in the playbook, that second step. It's paired with the community resource exercise. Both are data points for your broad coalition of stakeholders to look at and really analyze and decide where are we going to set the priorities for the work that we're going to do in the future. And the pulse survey, and we'll go through some of the questions of it in just a moment. The pulse survey, it's not meant to be sort of definitive data. It's meant to take the pulse of your community, to get thoughts and feelings and perceptions really around addiction and substance use disorder and prescription drug misuse. And you'll see that from the questions as we go through them. And the questions don't necessarily have a right answer. You can see a question on your screen right now, hopefully, where we ask, at what age should we be talking to people about drug and alcohol use, And prevention professionals have some very good evidence-based feelings about where this should be, right? We should, sometimes when we talk to folks in high school, that's a little bit too late. So we want to talk to them in middle school or younger. We want to reach out and talk about healthy behaviors as soon as possible as we can for our kids. But if your community isn't comfortable with that, that's something you need to know. Because if parents are going to be resistant to the public awareness campaign that you're going to roll out to the middle schools, you know, that will help you understand, well, maybe I need to build some bridges with parents and teachers first. If my community thinks that we should really only be talking about drug and alcohol use to high schoolers and college students. And so that's just one example of a question that doesn't really have a right answer from our perspective as the Community Pulse survey. We do have two formats for the Pulse survey. You'll see in the playbook, and I will send out to participants afterward the sort of a PDF version of the Pulse survey, something you can print out and people can check the boxes with a pen or marker. We also have an online version, which is a SurveyMonkey tool that we use for many communities that we're working with right now. And we can actually create a unique link for your community that, you know, if this is something you're interested in deploying in your community, you'll have a unique link that you can send out to your users that will be specific to your community. And then we can send you a specific page where you will see the results for just your community in live time. And then of course, once the survey closes, we can send you all the final data, all the raw data, and you can analyze it however you will. But we do have these two different versions of it. If you have a survey tool that you use in your local government or your nonprofit and you would rather use that tool, we're fine with that. We're fine with you taking the questions and entering them in whatever tool works best for your community. And I wanted to talk a little bit about our goals because, you know, obviously when we're talking about surveys, we know that at the end of that survey, there's some data. But really the survey, the data is important and the data is the key part and the most, you know, central part, but it's also important to use the survey to engage with your broad coalition of stakeholders. You know, when you're starting a group who is focused on solving a complicated problem like the addiction epidemic or opioids, you can bring people together, but then very quickly you want to keep them engaged by giving them something to do. And the Pulse survey really gives those stakeholders something to do. It's not just having your stakeholders fill out the survey, it's your stakeholders using their network to send out the survey to get as many people to fill it out as possible, right? And by doing that, you're going to get more and more people engaged, and you're going to show your stakeholders almost immediate results about how, when they're talking about what they're doing, more people will get involved. Obviously, you're going to get feedback from the community. You're going to get feedback through the survey, obviously, but talking about the survey is going to start conversations in your community that will have positive results as well. You're also educating your community. You know, sometimes just by asking a question, you can provide some education. You know, one of the questions that we have on the survey is, do you know where your local permanent prescription drug drop-box is, or medication drug drop-off place is? And, you know, someone might click no on that because they don't know, but that might create some curiosity and they might go looking for that. Or when they see one, they'll recognize what it is and they'll remember it for next time. So there's really an education component in that as well. You're really getting people in the habit of engaging with your coalition and your broad stakeholders to talk about addiction and solutions. And then finally, obviously, the data that you're going to get on the other end is important, that you're going to discover those community attitudes around substance use disorder, those perceptions, thoughts, and feelings that are really going to help you as you move forward. So here are some sample questions. You know, like I said, there's really no wrong answers, even though we know that there are some right and wrong things up on the screen. You know, if I have leftover medication but I no longer need it, our hope is that you're not going to sell it. And definitely our water treatment folks are hoping that you don't flush it down the toilet. But really, we want to know what the community thinks is the right thing to do, because that's going to provide us with a starting point for education. I'm going to try and start a little poll that hopefully you all can see with one of our questions. It's the question you saw before about what age should we start talking to people about drug and alcohol use. And I've sort of given you the answer. So this might be easy, this might not, but these are the types of questions that our folks are going to answer as part of the community pulse survey. All right. Well, I think you guys did pretty well. We had 67% with elementary. At what age should we start talking to people about drug and alcohol use? Elementary school aged. Let's try another one. So this question, again, no right answer. We hope our community knows where they can turn for addiction help, but if they don't know, then that's something that we need to work on. Then we know, having events where we pair that event with a resource fair so folks can see the resources within their community around the room is going to be very, very important. So asking where they know, if they know where to turn for help is a key data point. All right, so 67% of you think you know where to go for help. I appreciate that. So these are the types of questions. And again, you can see at the bottom of the screen, there's a link to the SurveyMonkey survey where you can see all 15 questions. Our goal was to design this so that somebody could do it while they were in line at the coffee shop waiting for their coffee. So it's not very intensive. It's probably not going to hold up to a peer-reviewed scientific journal, but it's going to give you a data point as you lead your community into discussing solutions to the addiction epidemic and how they can support people in recovery and their families. Okay, why evaluate? This, I've definitely heard folks say, this is a lot of work. I'm a professional. I've been working in this field 20 years. Why do I need to engage and evaluate in the community in this way when we know what the answers are? And so a key part of this is we do know a lot of best practices from around the country, and that's sort of something that's been important to us at SAFE Project to build up, and you'll even see those in the third section of the playbook, the tools from across the country that we think are good examples of things that you can deploy in your own community. But those solutions are only going to be effective if the community buys into them, if the community understands why it's a gap that needs to be filled and they agree. And so, making sure that solutions depend on accurately identifying the problem, right? We have to accurately identify what the problem is before we can match it with the solution. And we want to have community input on that so that we have community buy-in for our solutions, whether that means increased funding, just local neighborhood support for something, for example, like recovery housing or what have you. It also means we need this data because there's no community in this country that has a bottomless bucket of resources available to tackle this issue, whether those resources are time, talent, or money. And so we are going to have to prioritize. Our goal at SAFE are those 6 lines of operation, but we understand that you're going to have to use this data, this information, along with the publicly available statistics and data that we'll talk a little bit about next webinar, to make sure that we understand where we can have the most impact. Also, we do have a lot of knowledge as practitioners and as people who are concerned about this issue. And as we learn more and more, there's so many interesting things happening all across the country, and it can be exciting to want to implement those in your own backyard. But the good idea fairy is real, y'all. and good ideas are wonderful. But those good ideas need to be backed up by the needs and wants and opinions of the community. It's very much rooted in this philosophy that came from the disability community and other communities as well. Don't create a solution for us without involving us. And so it's really important that we do that, not just for the recovery community, not just for people in treatment or in active addiction, but for their families, their friends, their loved ones, and the community at large. All of them need to have a voice so that all of them are invested in the solution. Also, by going through the process of promoting your survey, you're going to engage with your stakeholders, you're going to engage with your community, and you're going to educate the community on the good work that you're doing in addition to the Pulse survey. And I really can't emphasize that enough. You know, I really believe that by pushing this survey out and talking about it and really making it a campaign, you can use that as a public awareness tool for your efforts. So we've created a couple of tools here at SAFE Project to help you use the survey both on the front end and the back end. So first, like I mentioned at the top of the webinar, we can create a unique link for you that will be specific to your community, and then a unique link on the back end that will show you the results in real time, right? We don't really want to evaluate our results until we have all the questions, all of the data in, right? So until we finish. But at the same time, we understand you're going to want to see those updates. And so this tool allows us to provide you that feedback on a real-time basis. And you can have that unique survey results page. You're actually looking at a survey result for Rochester, Indiana, for the Pulse survey that they rolled out. We also are creating a communications and marketing package for the Community Pulse survey, and you can see an example of one of the graphics that we've created up on the screen. The idea is that we want to make it as easy as possible for you to roll out the survey. And so we're putting together a list of sample blog posts, a guide on how to engage with local media, some sample social media posts and related graphics, promotional emails, all that you can just very easily customize to your community and then use to send out both through your stakeholders and through those local media connections that you might have. We're really excited about this. We think our goal here is sort of to demystify and make it as easy as possible for you to get that data so that you can move on to doing the good work. Hold on. Once you have the survey results, you know, the question is, what do you do with that? We've talked a little bit about this, but really this data is going to help you narrow the scope of the projects that you're going to do with your broad coalition of stakeholders. Like I said, none of us have limitless resources, time, talent, or money. And so this will be a way to help you focus on high impact, high return projects that will move the needle the most. For example, you know, if you have a local law enforcement authority who's all in and, you know, understands addiction is a disease and not a moral failing, and his force is on board and they are, you know, taking people to treatment instead of taking them to jail. But on the other hand, your medical community still has high prescribing rates and maybe doesn't understand the issues involved there, or pharmacists who maybe aren't up on the local standing order regarding naloxone. You can focus your efforts on there. And then once you've, you know, brought that piece of the pie, the piece of that line of operation, you've improved that, then you can sort of refocus, okay, what else can we do to help our law enforcement community continue the really good work that we're doing now that we know that we're not sort of causing more issues over here with our medical community, our medical response. That's just one example of how you can use it to define your priorities. And really, the Pulse survey is meant to be used in conjunction with the resource exercise. The resource exercise we'll talk more about next time, but it's really about mapping the assets that are available to you in your community. And we have a form that you can use to do that, but you're also going to want to take a comprehensive look at that. You know, where are the local treatment facilities? Do we have local treatment facilities? What's inpatient, what's outpatient? What are our recovery supports? What do we offer within government? Where is the faith-based community? All those sorts of things. Like all of our tools, that resource exercise is broken down by line of operation, so you can really drill down into each one of those specific areas and see where you might need to improve. But we'll talk more about that next time. I'm going to open it to questions in just a second. I know I already have one, but I do want to ask you at this link below, and it should be emailed to you as well after the webinar, though it may be tomorrow, is a little evaluation survey that we'd love if you fill out once our webinar closes. We're really we can always improve. We are always a work in progress, and so we rely on your feedback to know how we are executing. So I do have one question. Do you have specific techniques and examples of how you had partners share the survey with their networks and how that expanded engagement? We have a great example from Rochester, Indiana. They used the survey and rolled it out to a couple of communities. They actually organized some events around it along with the community resource exercise. And they had at first not too much increased engagement, but over time had increased engagement, which we were really excited about. They're still, their community pulse survey is still open and is still sort of barreling along, but that's just one example. We really are excited to see where we can take this. We have grand plans for it. We actually are hoping for a national rollout so that when you do have your community fill out the survey, we will have some national benchmarks that we can compare your results to, so that you can see, you know, okay, well, is it strange that my community doesn't know that we have 6 permanent drug drop-off locations? Or is that an information drought that everybody's suffering from? So that's really one of our hopes, but that may be, 6 months or more down the road at this point. Another question, is this something a small team of 2 can manage, or will we need extra help? So to manage the survey, it's really a plug and play. You won't need to do much. It's really with that sort of marketing and exposure piece where you're going to have the most work. And really there, you're relying on your stakeholders, on the people you've identified in sort of that first step of the community playbook, to be your worker bees and to send it out, not just to the people they work with. You know, if it's a behavioral health facility, you're not just sending it out to the employees, but they're sending it out to their friends, and they're sharing it on Facebook, and they're putting it on Twitter and Instagram. And so they're catching people who are in a broader area than just those of us who sort of work, quote unquote, in the space. I always tell my coworkers when we're talking about engagement and audience that my goal is to reach the PTA president, the man or woman who attends their city council meetings because they're concerned and they want to speak up about something in their community. And so while it's important, and it's not just important, but it's fundamental that we get input from families, loved ones, friends affected by substance use disorder, it's essential that we get feedback from people who are in recovery. But it's just as essential that we get the feedback from the broader community, because it's those hearts and minds that we're really targeting with some of our efforts, particularly with public awareness. All right, another question. With our marketing materials, will we be able to adapt those? So yes, so you can absolutely put your logo on our on the materials that we're going to offer as part of the package of communications pieces. So it'll have the SAFE project on one side. You can put your logo on the other side and roll it out. We would love to sort of have that opportunity with you. And again, as with every step of our process, we are willing to help you to whatever extent you need help. Our help comes free of charge, and it's part of our mission. It's part of the reasons that we're here, and we want to provide that opportunity for you. And so we have done, facilitated conversation sessions around the resource exercise with communities. We've done sort of modified strategic planning events with task forces, and we'd be excited to bring that to your community as well. Do we do one-on-one calls with communities if we have further questions? Absolutely. So my contact information will be at the end of the webinar, and you can also find me on the safeproject.us page. Our next webinar will be in 2 weeks, and you can actually register at this bit.ly link. But my email is josie@safeproject.us, and you can email me. You can also email community@safeproject.us. And we can schedule a time to talk one-on-one on how we can roll these out in your community. And that's really, that offer of one-on-one help goes not just for the Pulse survey, but for all of the resources that we offer within SAFE Communities, including the SAFE Community Playbook. So yes, so our next webinar will be in 2 weeks, same time, same bat time, same bat channel. And we'll be talking more about the community resource exercise and some of the other data points that are publicly available that you can use to, when you sit down and look at the resource exercise and the pulse survey, to help define your priorities. You'll be able to see recordings of all of these on our training page, safeproject.us/community/training. We'll also be including information on how to register for upcoming webinars on that page. So we're really excited about that. It's going to be kind of a library of all of our webinar series. And then finally, my contact information here is available to you at any time. One more question. Do we work with employers, housing providers, faith communities, hair salons, barbershops, libraries, fitness centers, and other allies to get a broad reach of people? What techniques do we use? Are there specific ways to have people share? So we do work with that broad coalition, you know, as part of our stakeholder building piece of the playbook. We encourage folks to find someone from the Chamber of Commerce, from the local business community, the faith community. We want community leaders, not just people who are in the space, not just in the health department or in city government. We want nonprofits, like I said, faith communities, to really have a seat around the table. And so the goal with that is once you have them around the table, we will give them this tool in the community resource, the community pulse survey to use and to roll out. And that's one of the things that Rochester, Indiana has done. A number of other communities are sort of just in the beginning stages, so we don't have a whole lot of metrics for them. But many of them are using social media, sharing on Facebook, you know, especially with the parent community. There's a strong network of support between parents on Facebook, and they are actually a really crucial part in that outreach. So yes to all of those. Yes, we want it to be everywhere. We've actually had a couple of people who interested in the survey who thought about even getting iPads and going to the local minor league baseball game and having people fill it out on the iPad, or, you know, thinking of creative ways of getting outside of just having sort of the usual suspects fill out the survey and have a piece of that conversation. But we're really looking forward to seeing those success stories in the future. All right, well, thank you all so much for taking the time to sit with us today. I really appreciate your time, and I hope you will join us in 2 weeks for our next webinar. Like I said, the invite for that will be up on our training page soon, and we will talk to you then. Thank you so much.